Discuss about sternum. Sternum is divided into three parts: manubrium, body, and xiphoid process. Sternum is 17 cm long. Now let us talk about manubrium. It has two surfaces, anterior and posterior, and four borders: superior border, inferior border, and two lateral borders. Now, anterior surface. Anterior surface is convex from side to side and concave from above downward. The posterior surface is concave. Now let us talk about the borders. Superior border is thick, rounded, and concave. Superiorly, it is marked by suprasternal notch, or we can say jugular notch or intraclavicular notch in the median part. The clavicular notch, it articulates with the medial head of the clavicle and makes the joint which is known as sternoclavicular joint. Inferior border forms a secondary cartilaginous joint with the body of the sternum. The manubrium makes an angle with the body which is convex forward, which is known as sternal angle of the Lewis. The lateral border forms a primary cartilaginous joint with the first costal cartilage. Now come to the attachments on the manubrium. Anterior surface give origin on either side to the pectoralis major muscle and sternocleidomastoid muscle. Posterior surface give origin to the sternohyoid in upper part and sternothyroid in lower part. Body. Body is longer, narrower, and thinner than the manubrium. It has two surfaces, anterior and posterior, and two borders and two ends, upper and lower end. Anterior surface is divided by three transverse ridges into small segments which is known as sternibrae. Posterior surface is concave. Now come to the attachment on the body of the sternum. Anterior surface which give origin to the pectoralis major muscle on either side. On the lower part, posterior surface, it give origin to the sternocostalius muscle.